Ben Rader and Dr. Mike Zussman. We're with the Public Education for Wisconsin Psychological Association, and we're here today answering some important questions about the use of telehealth and other modifications during the coronavirus outbreak and ways that we can all stay safe. Hey, Mike, good to see you.
Hey, Ben.
Looks like we're practicing some good social distancing here with our our setup.
Yeah, although I'm less than 6 feet from you.
Yeah, that's good. That's good. I'm going to stand back from the screen. Listen,
yeah, that's probably a good idea.
Listen, I want to kind of get a handle on your perspective here as a psychologist, and in particular, a lot of people are still needing help out there. This is a scary time. People are needing to talk, and yet it's kind of hard, because people with that need to talk are afraid what's going to happen to me if I get in contact with this virus. So they're kind of held up at home. They're not wanting to go out and get some help. And I'm just hoping that we can give everybody some assurance out there that we as mental health providers are equipped to deal with this and what kind of things we're doing differently now in this time period. Can you share a little bit what you've been doing this last couple weeks to make it accessible for people?
Yeah, this is trying times for us. It's trying times for our clients. It's been really difficult. And I could give you my perspective as a professional counselor, mental health practitioner, but not as a psychologist. And from what I've seen, we kind of saw this coming in some ways. I mean, if you're following the news from months ago, you saw it rising in China and it's starting to creep over. And so with that, I was able within, the past week, 2 weeks ago, I would say, I started prepping my clients and saying, hey, with this coming, we may have to start to make some changes. And as it's not exactly ideal to have to do that, but, we really don't have a choice right now. We're all going to have to do this. So one of the things I told them is that we may have to move towards a video conferencing platform or to do therapy over the phone. So I think a key element to that was prepping them and letting them know ahead of time. And then as of last Monday, or over the weekend, I should say, not this weekend, last weekend, I started sending out emails to all my clients individually, which took some time to send out individual emails. But we have to do that and let them know, hey, this is what's going to happen. I'll talk to you on Monday over the phone and talk about this process with you before we get started on the video conferencing. Some people just flat out said, you know what, I am not comfortable with this at all, and I don't have enough privacy in my home. I have, there's 6 kids in the home and 2 adults. I have nowhere to go for that.
Right.
So, trying to come up with some creative options for them as far as what to do. And then some people responded by saying, I don't need to talk. Let's just do it. Let's just get going with this. I'm so happy that I don't have to come in. Thank you for doing this. I've had a lot of response like that.
That's great. Yeah. And I know people are kind of anxious about it all. Once they get on the telehealth and they're talking to you kind of in a format similar to this, how do you sense they're taking that?
Every time I go on, it's like, oh, you're there. Like this magical, you exist on the screen and you still exist even though I'm not in your office.
Right,
so,
right.
And I would say almost 100% of the time, I'm always greeted with smiles like, oh, I'm so excited we could do this. This is really interesting to be able to do it over video conferencing. And, people seem to be responding well. And I think in general, if anything comes from all this, it's sort of like the whole concept of the military, the army, right? Where, your whole platoon or whatever you call them, I'm not familiar with the concept of that, but your whole platoon, the enemy is your drill sergeant. Mm-hmm. And so it kind of binds everyone together. And in this case, no matter what your political views or anything, there's one common enemy out there. And I think in a lot of ways, it's kind of drawing us together, binding us together.
Right.
So.
Yeah, that's a beautiful perspective. perspective. I got so before we go, I was curious if you have any general word of advice for people out there through this time period, and kind of how to get through. Do you have, as a mental health provider to the general public, something that you're saying or that you would like to share with the common person?
Yeah, absolutely. I think right now, kind of like what I just did, in taking what the good out of it that you can, because there are some really good factors that come out of it. Not only is it kind of binding us together, but I mean, for my family alone, it's forcing us to slow down. I'm not driving my daughters to dance every night and here and there and back and forth. I'm not using gas. I'm not using my car really much at all. And I think, if I were to, whenever people ask, how do you get through this? How am I supposed to do this? I think it's important to look at those positive aspects and limit yourself on the news. I've been suggesting that people go on in the afternoon to look, get your update, which is important, and then get off. You nothing more that's going to happen the rest of the night. You don't want to go to bed thinking about this.
Sure.
Get your update in the afternoon and then get off of it and clear out.
Hey, that's some great advice, and I think I'll be taking it too. We're inundated with some information right now, and it does feel good to scale back a bit and to be with a family. And I really appreciate your perspective on this, Mike, and your optimism is infectious. I really appreciate your spirit here right now.
Well, thank you.
All right.
I'm glad we're able to do this. This is great.
All right. Yeah, you bet, my man. Thanks a lot, and be safe out there.
Yeah, you too.
Cool.